Governor Cooper's plan to require state employees to get the COVID-19 booster is in the state is in limbo, actually.
He signed an executive order this month calling for that, but it's conditional on the CDC making a change that isn't happening.
Yep, Capitol reporter Michael Hyland's covering this for us live in Raleigh. And Michael, you talked to the governor about this. What did he have to say?
Well, he pointed to the science showing that the booster is effective at helping people combat Omicron, but this requirement that state workers get it still isn't going into effect. Governor Cooper is already requiring more than 50,000 workers under his authority to either be fully vaccinated or get tested weekly. When he signed the executive order calling for them to get the booster shot earlier this month, it included a provision saying that would go into effect if the CDC changes the definition of fully vaccinated to include the booster. They're not doing that. Instead, the CDC is saying you need the booster if you're eligible to be considered up to date, but you are still fully vaccinated without it. When I asked the governor about this, it wasn't clear if this booster requirement will ever go into effect.
We are working very hard to get people boosted, and in order to increase our workforce, to get all these folks to people that they need in order for us to get back on all cylinders, we've got to get more people vaccinated.
Data from the state shows 78% of state employees subject to the requirement are fully vaccinated, compared to 70% of the adult population statewide. It's not clear how many of those employees, though, have chosen to get the booster shot. Live in Raleigh, Michael Hyland, CBS 17 News.
Well, Michael, why isn't the CDC making this change what it means to be fully vaccinated?
The CDC director says that this phrase up to date is what they use with other vaccinations. And there are some experts who've weighed in on this too and wondered if we ever should have been using the phrase fully vaccinated, given that after the fact we are encouraged to get the booster shots. And there's even talk of getting another booster after the one we've already gotten.
Oh, let's hope not.
Yeah.
We've got a lot of shots. All right, Michael Hyland live for us tonight. Thank you.